Welcome to the DSO Hygienist Podcast, where we deep dive into the world of DSO hygiene. I'm your host, Christine Deal. I'm a practicing clinical hygienist with over 30 years of experience. 7 years ago, my private practice was bought by a DSO. I am an advocate for hygienists working in the DSO space. DSOs are transforming the dental landscape. It is predicted that they will be 39% of the industry by 2026. Hygienists play a critical role in a DSO by providing excellent patient care. Discover how DSO hygienists can advance their careers and make a meaningful impact in the field. From career growth opportunities to in-depth discussions on the challenges and triumphs of the DSO hygienist, in this podcast, we will provide exclusive insights, expert interviews, and real stories from passionate hygienists who are making a difference. You won't want to miss a single episode. Our guests will provide clinical guidance, emerging trends, and needed support. Even if you aren't currently in the DSO world, you will benefit from a wide range of topics. Subscribe now to the DSO Hygienist Podcast and be part of the conversation. Your journey to happiness and success begins here.
I'd like to thank our sponsor, H2 Ocean. Our guest today is Dr. Rajiv. Dr. Rajiv holds multiple academic and industry positions and is proficient in building science-driven scientific strategies. He graduated from Harvard Medical School, Harvard University, with an expertise in clinical operations and a concentration in the industry leadership track. A dentist by training, he is a subject matter expert in the field of periodontology, focused on oral systemic linkage. The fundamental driving suspect of all of his prior research has been researching the host response to periodontal infection, which causes a complicated cascade of inflammatory-immune sequential processes, making periodontitis a well-established risk factor for many systemic disorders. His work in this sector has received worldwide recognition, with over 150 plus peer-reviewed papers published in high-impact scientific journals. He has written 5 books and 3 book chapters. His books include Science of Sea Salt, Dental Plaque, a biofilm, Fundamentals in Clinical Trials and Research, Hospital Infection Control, Clinical Guidelines, and Dental Horizons, Essentials of Oral Health. I can't thank him enough for taking time out of his busy schedule to talk with us today. Welcome, Dr. Rajiv.
Hi, Christine. So nice to having you in your podcast show. Thank you very much for having me in.
I am so excited to have you on the show today. You have such a wealth of knowledge, and it's really, really going to be great to get this out there to the hygienists in my community. I'm going to start with the questions right away. That's kind of what we do here. It's kind of fast and furious. So what I want to know is, when should you begin non-surgical periodontal therapy?
Yeah, a very good question to start off this conversation. So, non-surgical treatment of periodontal disease should begin as soon as early signs are detected. I mean, these signs include gum inflammation, bleeding, receding gums, pocket formation between the teeth and the gums. So any early intervention can prevent the disease from progressing to more severe stages that require surgical intervention. Yeah.
Yeah, very good. So early, we've got to get it early.
Yep.
That's probably the best outcome, is if we start treating early and we don't watch it, correct?
Yes, 100%, because the initial stages are well managed non-surgical way through, regular cleaning and through deep periodontal cleaning. But if the stages exceeds to a certain level, and when you have the microorganisms go beyond the certain pocket depth, then it's really hard, and you have to really debride them and go with the surgical steps to that.
Right. So when you're treating early periodontal disease, is the ultrasonic the most effective at disrupting the biofilm?
Yep, 100%. So ultrasonic scaling is highly effective at disrupting the biofilm and removing the tartar from above and below the gum line. So that's very important. And as you know, ultrasonic scalers uses high frequency vibrations to break up bacterial deposits and is often more efficient and less invasive than manual scaling. So I usually recommend 100% that ultrasonic is the great choice of disrupting the biofilm.
That's great to know. So you recommend that like doing the ultrasonic first, finishing with scalers, or what would you recommend?
Yes, so ultrasonic scaling followed by scalars and then polishing will be a great way in order to remove the plaque and make the surface smoother so that bacteria and plaque cannot get hold towards each other. And the whole scenario in this is that we are trying not to make that plaques co-aggregate towards each other and form a biofilm. So once a biofilm is formed and turned into calculus, or you can say a tartar, or in a day-to-day language, you can say that it's build-up. So once you have that build-up, it's very difficult for a person to maintain their oral hygiene, and you have to physically through ultrasonic scalers, you have to remove that. So that's why they are very important in maintaining your good periodontal health.
Got it. Now, besides tooth loss, what other risks are there for untreated periodontal disease?
There's a plethora of documentation, evidences, clinical outcomes. So, if untreated periodontal disease can lead to several oral health issues that include chronic bad breath, halitosis, and bone loss, and the jaw bone loss receded with time, the gum recession, leading to tooth sensitivity and an increased risk of tooth decay and systemic infections. So bacteria from mouth can enter into the bloodstream and can affect to the different parts of the body. And that's why there's a huge evidence like with a well documented evidence and science and research behind that how the oral health is directly connected to so many systemic health and diseases.
Yeah, and can you discuss and elaborate on that a little bit? Because I know this is something that you are very passionate about, is the oral
Yeah.
systemic link with periodontal disease. So could you just highlight some of the other conditions that really put you at risk once you've been diagnosed with periodontal disease?
Yes, periodontal disease has been linked to several systemic health conditions, and few of the top of them include the cardiovascular disease. So, inflammation from periodontal disease can contribute to formation of arterial plaque, and that may contribute to a heart disease. So, that's very important to have a well-managed periodontal disease in order to maintain the cardiovascular health. Then, diabetes. Periodontal disease can make it more difficult to control blood sugar levels, and conversely, diabetes can increase the risk of developing periodontal disease, and they are correlated towards each other. So, diabetes can cause periodontal disease, and simultaneously, periodontal disease can also cause diabetes. And the third most important disease is respiratory diseases. Bacteria from periodontal disease can be inhaled into lungs and potentially leading to respiratory infections. So that's a very matter of concern, especially those patients who are admitted to the hospitals. So hospital-acquired pneumonia and infections can be a big and a severe problem to those patients. Pregnancy complications is also one of the greatest concern. We have seen a lot of scientific evidence, published papers, clinical research that linked periodontal disease to premature birth and low birth weight babies. It also lead to cancer, infertility, pneumonia, and so on.
So yeah, there is a lot of diseases connected. I'd like to thank our sponsor, H2 Ocean. H2 Ocean is a global leader in providing patented sea salt-based natural healing products that are trusted by millions, clinically proven, and backed by science since 2001. H2 Ocean Healing Rinse Mouthwash is the most safe, effective, and fast-acting saltwater rinse for daily oral hygiene. It is free from alcohol, colors, preservatives, chemicals, and dyes. Red sea salt is the key ingredient in H2 Ocean's saltwater rinse, which contains over 82 trace minerals, along with xylitol and lysozymes for added benefit. It also helps managing the oral side effects of radiation therapy and chemotherapy. H2 Ocean Sea Salt Healing Rinse is available in 2 flavors, Arctic Ocean Mint and Fresh Lemon Ice. They are available at www.h2ocean.com and at Amazon. Now, I know you are a clinical researcher. Are there particular products that you like for maintaining periodontal health?
Yes. I mean, I spend a lot of time in clinical research space and, investigating a lot of oral hygiene related products. And I found that the products who are closely related towards a better periodontal health are those which are natural and those that doesn't contain any alcohol, preservatives, chemicals, dyes, and other things. And I found that one of the great products that discovered through one of my clinicals as well as through my understanding is H2 Ocean sea salt based rinse. So what sets apart is that it's all natural and it is made up of the simple ingredients which you can read and understand very well. So basically it is made up of all 3 ingredients: red sea salt, xylitol, and lysozyme. So all these 3 ingredients make it a very unique combination of a natural mouthwash. I mean, I can put a light on why red sea salt. I mean, red sea salt is the most mineralized salt you can find in this planet Earth. It contains 82 plus minerals and it is always hand harvested and always unrefined. So that's make a huge difference. Secondly, it contains lysozyme. I mean, lysozyme is an enzyme with antibacterial properties that help reduce harmful bacteria in the mouth. And I want to add a note that lysozyme is a part of our immune system. It is present in our saliva, it is present in mother's milk, it is present in your eyes, in everywhere, in your nose. So this is part of your immune system. So that is also included in this mouthwash that act as a natural antibacterial properties. Third important ingredient is xylitol. And as we know, for last 50 years, xylitol has been proven for anti-cavity properties and it can prevent dental caries, being a natural sweetener from fruits and vegetables. So all these 3 ingredients make it a very wonderful natural mouthwash to maintain and support your oral health.
Got it. Now, I know we often tell people to use warm saltwater rinses. Now, is there a difference between just like table salt that we have at home and the sea salt that you're talking about?
Yeah, I mean, I'm glad that you asked that question, Christine. So there's a huge difference when you compare regular home-based salt rinse as compared to H2 Ocean patented sea salt rinse. So first and the most important difference is that the homemade salt rinse is just made up of 2 elements, sodium and chloride, while the Red Sea salt in the H2 Ocean mouthwash has 82 plus elements. Secondly, the table salt is highly processed, went through a lot of heat, temperature, and so all the mineral contents loses its properties. While the Red Sea salt is always organically harvested and always unrefined. Third important thing is that it is the table salt is always produced commercially, and Red Sea salt is always procured in a very small fractions because it is not chemically processed in big large factories. Number fourth is that when you use homemade saltwater rinse, there is no water to salt ratio control. There is no salt concentration, like how much salt you have in a one-time rinse. But when you use an H2 ocean salt rinse, there's an always controlled amount of the exact amount of the salt balance which are needed for a oral hygiene purpose. Secondly, is like, what about the quality and the purity of the water, right? So in H2 ocean, we have purified reverse osmosis water, right? And as compared to the salt rinse made at home, it doesn't have that kind of purity level which is required, especially if it is going to rinse on your bleeding gums or going below the gum line. So these are the very huge differences. And along with that, as I previously mentioned, the regular table salt will not have lysozyme and xylitol. And that's what you are also getting additional benefits when you're using H2 ocean-based sea salt rinse.
Got it. Now, is the sea salt rinse, is that effective at reducing inflammation and bleeding for our perio patients?
Yes, you can say that sea salt is effective at reducing inflammation and bleeding. And how? The high mineral content, particularly in the Red Sea salt, can help soothe the inflamed gums and promote healing. I mean, there's some clinicals done on patients given sea salt rinse after their extraction, and they have a better healing time once they adapt H2 ocean healing rinse as a part of their after dental procedure rinse. So definitely it's going to help tremendously in reducing the inflammatory cycles of the oral cavity, especially whenever you are going for an implant surgery, right? So dental implants is a big deal when you have to go with an abutment and the whole osseointegration process. In that particular scenario, healing plays a very crucial role. So I always recommend 100%. So the people who are going before and after implant surgery to have a well-balanced, controlled environment inside their oral cavity that supports the healing and that nourishes the healing cells through these natural elements and minerals and the antibacterial properties of lysozymes. So altogether gives a very soothing, calm effect inside the oral mucosa that really promotes the healing optimally.
And besides extractions and periodontal disease, what other oral conditions would this be appropriate for?
Yes, so it can be highly effective while if you have mouth ulcers, helping to reduce pain for the mouth ulcers, for the cankers, and for the sore throat. I mean, in the winter time or even in the day-to-day time, I mean, if you gargle with this H2 ocean sea salt based rinse, the inflammation and the cough and the soreness of the throat goes away very fast. Secondly, the most importantly nowadays, because of the lot of cancer patients we are seeing, unfortunately, and there is a huge oral side effects of radiation therapy and chemotherapy.
Mm-hmm.
And to that extent, most of the oncologists, dentists, and the supportive team recommends salt rinse, warm salt rinse as a part, to settle your oral inflammation and the mouth, because you cannot use the regular oral care products because they are too harsh. They bring that burning sensation. They have colors. They have dyes, so they are not recommended. So this mouth rinse, H2 Ocean Healing Ring mouth rinse, is the best remedy for someone who is dealing with the oral side effects related to radiation and chemotherapy.
Yeah, that's really good to know. There's so many people out there suffering, and if we could recommend something to our patients that could help them through that terrible time, that's just wonderful.
And
So
and I also want to add
yeah.
one more thing. And I also want to add one more thing, Christine.
Mm-hmm.
It is one of the safest mouthwash. So the pregnant women, right? So they have to really take care of their oral health during pregnancy. So it's safe. It doesn't contain alcohol, no chemicals, no dyes. So they can use it with 100% trust that it is natural, made with all natural ingredients. And secondly, our pediatric patients, right? So our kids and children can use it without the any fear and factor of like accidentally they can take inside. So it's one of the trusted and safest oral care rinse present in the market today.
That is really fantastic. And it's really good to know that pregnant women and children could use this as well. I would really like to thank you for being our guest today. And I'm sure there are a lot of listeners out there that probably have a ton of questions because we've only scratched the surface with you. Is there a way for them to get a hold of you? Go ahead and let us know.
Yes, I mean, in order to get this product or in order to reach out to me, I really appreciate if everybody can go buy and purchase this product if they really want to through the official website of H2 Ocean, that is www.h2ocean.com. And it is also available on Amazon. In fact, it is the highly rated 5-star rated product in Amazon Choice product. And secondly, if you are reach out to me, you are more than welcome to reach me through my LinkedIn at Rajiv Sani. And also you are more than happy to reach out our customer service team for the company info at h2ocean.com. And also you can reach out to me personally, Rajiv at h2ocean.com. So in that case, if you have any additional questions or if you want to know anything more about detail about the product, I am more than happy to help you out on that.
Well, thanks so much for sharing your time with us today. I know you are extremely busy, and we have just been so honored to have you. We need to be educated on gum disease and products that are available out there that can really help our patients in their time of need. So thank you so much for joining us today.
Thank you, Christine, for having me on your podcast show. And it's always an honor to chat with you and interact with you. And thank you also to you for doing all this wonderful work and bringing so much education and world of knowledge to your listeners. I appreciate that.
Thank you.
Yeah, thank you.
Thank you for listening to the DSO Hygienist podcast. Please follow or subscribe to be alerted of new episodes.